Hello and welcome. Today we have with us Mr. Anubhav, and a specialist in IVF, and so we are going to have a discussion about fertility and later pregnancy with him. Welcome, sir.
Thank you.
Sir, so my first question is, nowadays we see this trend of women choosing pregnancy at a later stage.
Right.
So in such a scenario, how does IVF play a role?
Sure. So, like you said, I think women of today have a lot of choice in hand, which is really not true for a lot of older generation women. And it's a big boon, right? Women like yourself who are very empowered. You plan your life stages as per your choice, whether it's career, whether it's getting married, or even the choice of having a family and when to have a family. So I think what medical science allows today is to really give the control in the hands of the women. And there are technologies, for example, like egg freezing, etc., where a woman can choose to freeze her eggs as early as when they are in colleges, or they start working, right? And what it really does is, and because technology has become so advanced, that you can freeze your eggs up to 10, 15, 20 years as well. And at the right juncture, where you think it's time for you to have an offspring, and then you can do so. Right? And I think globally across, this is a very well accepted phenomenon. In India, what we have seen typically is only the so-called the riches in the country or the famous personalities have done that.
Right.
Either in the country or maybe outside the country, because the facilities were not available, or they choose not to disclose, because that was the other problem with the whole infertility space.
Right.
But when it comes to egg preservation, it's not necessarily infertility. It's actually taking a choice in your hands.
Right.
And it talks more about the preventive side of things rather than curative side. So you're not treating anything.
Right.
You're talking about healthy women.
Right.
In their early teens or early 20s, and making career choice and saying, because with age, the quality of eggs that the woman produces, and every woman or every female is born with a limited number of eggs at the time of birth, and they deplete, and they also deplete in quantity and quality both.
Right.
So earlier in your lifestyle, you take this choice, you really buy that option of choosing when you want to treat.
And sir, the last leg of the conversation, I want to focus on this very pressing issue, which is now being read more, studied more, that infertility earlier was associated with just women, right? But men are as they are equally responsible. So when we talk about IVF, are men seeking these let's say alternatives or these preventative measures? Do we see a difference now from, let's say, older times, or is there still a little bit of taboo and stigma around men seeking help?
Right. So first correction, that it was always perceived that women caused infertility, or women were the root cause of infertility.
Right.
Men were always an equal contributing part to infertility, almost 50%. So it was always both sexes that were involved. It's more accepted now, and it's more known that the male part is even more prevalent. At Apollo, we try and push a lot more screening, like everything else. So we have something called score over infertility. So what we said was, can we make infertility conversation more like a count parlay? So you sit, you ask your friend, hey, what's the match score today? So similarly, I can ask you, hey, what's your fertility score? Which is say, can you go and get yourself tested, both as partners or as individuals, and then say, okay, how's my fertility rating? Something like that. You do an annual health check, and you get a score of fitness. Just like fitness of your fertility, right? So that's how we're trying to push it through a screening mechanism. And because we also do the largest number of health checks in the country, we see now an increased acceptance of men to look at this. And we try and do a little gamification around it. And obviously there is a lot more aggregators available where this is also available as a service, as a tool. So you can order a score over fertility online. So, but yeah, I do see males coming forward and doing it.
All right. So sorry we have to cut it short.
No problem.
We are running out of time, but thank you so much for this conversation.
Thank you.